Anyone who's ever had a wisdom tooth out knows the surgery is, well, it's just the start. The real battle is the recovery, right? But what if you could slash that recovery time, dial down the pain, not with more pills, but with light? It sounds like science fiction, I know. So let's get into some really cool new research that might just change dental recovery for good.
Oh yeah, we've all been there. You're in that chair and it's not the procedure that's making your palms sweat. It's the thought of the next few days. The throbbing, the chipmunk cheeks, the struggle to even eat a bowl of soup. It's a pretty miserable experience that can just put your life on hold. And yeah, the usual aftermath is a pretty grim checklist. First, you've got the pain, that's a given. Then comes the swelling. And then there's this thing called trismus, which is just a fancy way of saying your jaw is so stiff you can barely open it. All of this adds up to a long, slow recovery, where you're just counting the minutes until you can take the next painkiller. And that's the thing. Our standard game plan is just drugs. We throw analgesics and anti-inflammatories at the problem, and don't get me wrong, they can help, but they also bring their own baggage. We're talking potential for allergic reactions, stomach issues, and in some cases, even problems with your kidneys. So you can see why finding a safer way to do this, a non-drug alternative, would be a total game changer.
Okay, so this brings us to a potential solution that honestly sounds like it's straight out of Star Trek. A therapy that uses nothing but light to help your body heal. It's called photobiomodulation. It's a big word, I know, let's just call it PBM. The idea is actually pretty simple. It's a therapy where you use very specific types of light to basically talk to your body's cells, telling them to dial down the inflammation, ease the pain, and really kick the whole repair process into high gear. So how in the world does this work? Well, think of it this way. Your cells have tiny little engines inside them called mitochondria. The light from the PBM device is like high-octane fuel for those engines. It supercharges them, they produce more energy, and that extra energy gives them everything they need to repair tissue and fight inflammation way, way faster than they normally could. Now that all sounds amazing in theory, right? But the real question is, does it actually work for real dental patients recovering in their own homes? Well, a new study was designed to find out just that. So a team headed up by Professor Walid Altayeb, who's actually the president of the Academy of Laser Dentistry, set up a pilot study, and they focused specifically on a PBM device that patients could use themselves at home after getting their wisdom teeth pulled. This is so important because it's all about making this kind of advanced tech easy and accessible for everyone. And the way they designed the study was just brilliant. It's called a split mouth design. Each patient had teeth removed from both sides, just at different times. After one surgery, they used a sham device that did nothing. After the other surgery, they used the real PBM device. This means every single patient acted as their own perfect control group. You're comparing the left side of your mouth to the right side of your own mouth. It's a super powerful way to get clean, reliable results. So, with this really clever setup, the researchers tracked everything for 7 days after each procedure. And what they discovered, well, it was pretty remarkable. All right, first things first. The one we all care about the most when you're recovering from dental work, did it actually do anything for the pain? The results from day 3, which is usually the absolute worst day for recovery, are just wow. Look at that. The control side had a pain score of 17. The PBM side was all the way down at 8. That is less than half the pain. And that little p-value you see there, that just confirms this is the real deal, not some random fluke. Okay, so it crushed the pain. Awesome. But what about that other telltale sign of dental surgery? The facial swelling. By the end of the full week, the story was exactly the same. The PBM group's swelling score was, again, less than half of the control side. You can literally see how the light therapy was actively calming down that inflammation day after day. Feeling less pain and looking less swollen is great, but getting back to normal, being able to eat and talk properly, that's just as crucial. And that's where trismus, or that awful jaw stiffness, comes in. And would you look at that? By the 4th day, patients who used the light therapy could open their mouths with significantly less trouble. So they weren't just feeling better, they were functioning better and getting back to their lives faster. Okay, so this all leads us to the ultimate question. If you have less pain, less swelling, and your jaw is working better, does that mean you actually need fewer painkillers? And the answer is a huge, resounding yes. By day 4, the group using PBM needed drastically fewer pain meds. And this is so important because it shows the therapy isn't just masking the pain, it's helping you heal to the point where you don't need to rely so much on drugs and all their potential side effects. So what does all of this data really mean for the future of dentistry? Well, it points to a future where we put the power of recovery directly into the patient's own hands. So let's just boil this all down. What does this mean for you? It means a safe, drug-free way to take control of your recovery. We're talking about way less pain and swelling, getting back to eating and talking like a normal person sooner, and cutting back on pain medication. It really empowers you to be an active part of your own healing, all from the comfort of your couch. And this just fits perfectly with the whole philosophy of Professor Altayeb's research team. They believe that great dentistry isn't just what happens in the chair, it's about the entire experience, especially the recovery that comes after you go home. Now, look, this was a pilot study, and bigger studies are definitely needed. But the results here are so incredibly promising. It leaves us with this big question. Are we looking at the future standard of care? A day where getting a prescription for light therapy is just as normal as getting one for pain pills, leading to a faster, safer, and way more comfortable recovery for all of us.